Hello, welcome to Healthy Kingston, a health promotion and wellness program of the Kingston Board of Health. I'm Janet Wade, your host. Well, public health has certainly become a hot button issue, and there are many different topics that are being tossed around out there, and I would like to address a couple of them that are tremendously timely. Governor Healy recently announced the immediate steps to ensure vaccine availability in Massachusetts among the Trump and Robert Kennedy rollbacks. The Healy administration has taken a first-of-its-kind action to guarantee insurance coverage of vaccines recommended by the state. First, at Governor Healy's direction, the Division of Insurance and the Department of Public Health issued a bulletin just at the beginning of September that requires insurance carriers in Massachusetts to continue to cover vaccines recommended by the Department of Public Health and not rely solely on the CDC recommendations. Massachusetts is the first state in the nation to guarantee insurance coverage of vaccines recommended by the state. Blue Cross Blue Shield of Massachusetts and the Massachusetts Association of Health Plans all support the action. And this will ensure that Massachusetts residents can afford the vaccines they need and want to keep themselves and others healthy. Even if the federal government issues narrower recommendations, these include respiratory virus vaccines like COVID, flu, and RSV, and routine vaccines for children like measles, chickenpox, and hepatitis B. The action follows legislation filed by the governor, like I said, the earlier part of this month. Secondly, Governor Healy's administration has taken steps to ensure that Massachusetts residents who want to receive the COVID vaccine can do so at pharmacies. Earlier this month, it was reported that CVS and Walgreens could not offer the COVID vaccine in multiple states, including Massachusetts, because the federal government was no longer recommending it for adults. In response, the Department of Public Health Commissioner Dr. Roby Goldstein issued a standing order allowing pharmacies to continue to provide COVID vaccines to Massachusetts residents ages 5 and older. Children under 5 can receive the vaccine through their pediatrician. And additionally, the Department of Public Health updated its vaccination administration to permit the Department of Public Health Commissioner to determine which routine vaccines can be administered by pharmacies in Massachusetts, instead of limiting them only to vaccines recommended by the CDC. And as a result of these actions, CVS and Walgreens are working to make COVID vaccine appointments available to people in Massachusetts as soon as possible. And thirdly, under Governor Healy's leadership, Massachusetts is also leading efforts to create a public health coalition in collaboration with states in New England and across the Northeast, committed to safeguarding public health as the federal government backs away from its responsibilities. This multi-state collaborative is focused on developing evidence-based recommendations on vaccinations, disease surveillance, emergency preparedness, and supportive state public health labs. Right now, health providers in the state are taking their directives from the governor's office and the Massachusetts Department of Public Health, as is the health department in Kingston, Massachusetts. One other area that is very timely is the recent issue that was brought up about the connection between Tylenol and autism. And what has been suggested is that pregnant women who are concerned about taking Tylenol when having a fever or for any other reason should consult with their obstetrician to determine the best course of action until there has been more research that has been done on this potential connection. This month, we're very fortunate to have local Representative Kathy LaNatra with us. She has been a long-time public health proponent. And if you look at her platform, she has emphasized substance abuse awareness and also mental health issues. And those are the areas in which we're going to talk a little bit further about today. So thank you so much for being here.
Thank you for having me.
Absolutely. Among your platform priorities, as I had mentioned, substance abuse is and the fact that the opioid epidemic is the greatest public health crisis we face. You highlight the need for a comprehensive solution to address this crisis and prevent future drug abuse. This solution includes education, prevention, and treatment. Can you speak a little bit more to those three areas in detail?
Oh, I would love to. So, as you said, it's the biggest crisis we have right now, and it just continues. If you watch the news, you see different cities across the country, not only the Commonwealth. We have some cities, we have Boston, we have Mass and Cass, we have all these little different areas. But education and educating young, right? We can't wait until, they're too young to hear this. Well, a lot of these young people have grown up with addicted parents, and they've already seen it before they've gotten to school. And they need to know that there's help and there's resources out there. So I think education should really start young, right? Treatment, it's interesting. I have a new colleague, Representative Michelle Badger, and we were at an event at the public library in Plymouth, and I can't remember what it was called, but it was about substance abuse, and it was a celebration of all these people that have really done the programs, have worked really hard to stay sober, and are helping other people. They're reaching down, bringing a hand up, and helping these other people. So we've become entrenched in this community, and we've reached out. We were at South Shore Recovery the other day. We were at BAMSI, and we've been visiting to see all the different things that they're doing. And they all worked like in silos, but then again, they all work together as a community. So they're reaching out to other people in the community and really educating and helping them with the program. Not one program works for all, right? Exactly. AA doesn't work for everyone that's an alcoholic. There's all different programs. So they're really, some of them work so differently, but then they all work together to find the right program for that person. So I think it's really important, and the more education that we have and the more resources that we have, because people do live a sober life after that. They can get through addiction and live a very productive, successful life.
I can, as a registered nurse, and I've seen it repeatedly throughout my entire career. I couldn't agree more.
Yeah, absolutely. And a lot of these counselors or addiction specialists have gone through it, so they understand. They understand that you're going to have relapses, but you can get back up on that saddle and continue, start again day one. So I think it's really beneficial for someone to be with someone that's been through it, right? I think they listen. They understand more.
I get that very much so. Are you informed on any type of a cooperative in the area or of drug treatment programs that work in unison with each other?
We do.
That you can speak to?
So High Point happened to be at this event as well, and then we have Plymouth Youth, and I have PYDC, and I don't know what the DC. Do you know what the D stands for? Plymouth Youth. So they start early in the schools to educate, right? So it's a program that starts in the Plymouth schools and to educate against drug abuse and mental health issues and alcoholism and social media. I mean, it's a great program that Plymouth schools has, and they are work in collaboration with all these addiction treatment centers that are in the area. And they all seem to work together. So BAMSI deals not only with mental health, but deals with addiction. High Point has addiction, but they also have a mental health component, because they seem to go hand in hand a lot. So they do all work together. There's also PC Hope, which is an organization that they come together each month, and it can be, my husband was involved at one point. There's police officers, there's addiction specialists, there's mental health counselors, and they'll come with a person or a case, and I have this person, they're homeless, I want to get them shelter, but they have some mental health issues, I think there's addiction issues, is there anybody there that has a bed? Is there anybody there that can help? So they all come together to work on one case, I have a bed, maybe I can help this person. Oh, it sounds like they may have a little schizophrenia. I know another bed that might be better for them, and a facility that may be better for them. So we're so lucky in this community that everybody does work together to find out the best solution.
That's terrific. Yes, that calls to mind. I know, speaking with the police chief in Kingston. He has been a tremendous proponent of being proactive and helping to rehabilitate people. And I know BID sends out a counselor with a policeman after there may have been an incident with someone. After there's been an overdose. Right. Yeah. And which is so proactive, and it's not punishing. And I really applaud their efforts.
It's
I know
very important.
it's been a state awarded program. People think highly of it.
In Kingston, they've also, I think they just passed, they're going to have a social worker that works with the police force as well, which I think will be very helpful. As you know, and many of you may know, my husband's a sergeant in the Kingston Police. So a lot of their calls are mental health issues, right? Or they're domestics, as they call them, like domestics where it's not a criminal issue, but it would be very helpful to have a social worker there.
Oh, absolutely. Well, and as I'm not telling you anything you don't know, the effect on the family.
Right.
That the family needs this as much as the client does.
They do.
So,
that's why it's important when we had mentioned they send them, there's an overdose, they send someone the next day. And that's not for the person that overdosed, it's really for the family.
Right.
And how they can help and support the family.
You may not remember this. I remember several years ago, you spoke at the Council on Aging, and I remember seeing parents there who were so upset and were really seeking someone to be an advocate for them and to find places they didn't know where to go to get help for their child. And I think you've exposed that to the public, that there are places out there, and that I know the Public Health Department has a whole list of places now in the area. In fact, there's one right up here in the industrial park that people can go to who need counseling and follow-up care.
It's very important. And as a legislature, we came out, with the administration with the 988 line. A lot of people, so that's like the mental health. We have 911 when you have, a medical emergency, but if you're having a mental health emergency, we have 988.
Terrific. Well, I know there is a new drug out there on the streets.
Yes.
Kratom, that I'd like you to speak to, because I know you've got the rallying cry for people to know about this and its implications, particularly for our young people.
Yes.
And what people truly need to know about it, and its implications, really, for all of us.
Yes. So I had a phone call from a friend who's a constituent, and she has a friend who wanted to remain anonymous, but her son had an incident with this new drug called Kratom. And she asked me if I'd heard of it, and I didn't. And I have 4 children, I asked my children, and they hadn't either. So he was it was just a local gas station, actually, and he was getting it for energy. It was like a little energy shot that we see at a lot of gas stations, right? And we see them at convenience stores. And he was buying it daily, and one day maybe more than daily, could have been more. One day he was in there, and there was another younger gentleman behind him and saw him buying it. And he said, "How long have you been on that stuff?" He said, "About a month now." And he said, "It's going to ruin your life. You need to go home and ask for help right now." And the boy did, the young man did, and he wound up in rehab because he was addicted to it. So after a little more research, of course, I called the police chief in Kingston too, and he said, "Yes, I've heard of it." And we did some research, and it's, a natural leaf that's out of Southeast Asia, and it has opioid effects, and it's as addictive as opioids. You can be addicted within a week, and a lot of people have become addicted.
Wow.
So I looked into the legislation. We have like 7,000 bills that are filed each session, so I did a search, and I saw that there were 4 bills filed, and I reached out to those representatives, and one is Representative Colleen Gary, and she has a bill named after a young gentleman who is actually her friend's son, and he was in Florida, and he was going to a kava bar, which I had not heard of, but a kava bar is a bar where people go that don't drink alcohol, and it's like a root, and he was introduced to this seltzer that had Kratom in it, and it was, all he saw was no caffeine, no sugar, and thinking he's drinking a healthy drink. And when he went to the kava bar, that's what he would drink. And then he did not show up for work one day, and they did a wellness check, and he had passed away. And when they did the autopsy, it was found out that he had overdosed on Kratom, on that drink. He had at least three that day, and he had overdosed and died. So,
do you have any idea as to how it makes you feel?
Like you're on opioids, like you're on...
So like a high?
Like a high, yeah. They do market it as an energy drink. Sometimes it's an energy drink. A focus, so focus and energy, it's advertised at. It's in, you can drink it as a tea, you can have it in pill form, you can have it in that seltzer. So a lot of convenience stores, they call it gas station heroin is what the nickname is. So that's what they call it, gas station heroin.
Wow.
So just within this research and talking to people, yesterday we had a briefing at the State House that I hosted, and I had a physician from the Boston area talking about some of his patients had become addicted to this. I had the mother of the son who passed away. Online, we had some Zoom in of another mother from New York whose son passed away from it as well. And then another physician from Western Mass whose son overdosed, but he lived. And he was someone that just very health conscious, never drank, never smoked, and thought this was like a healthy drink. And he became addicted. And he was a licensed therapist, and he almost lost everything. He wound up in a detox for a while and is spending some time in Canada because they don't sell it in Canada. So he's spending some time as he recovers in Canada.
Wow.
Yeah.
Is it listed as an ingredient? How do you
So
know
on
if
this,
it's
I wish
in
I
it?
brought a picture of the seltzer bottle. It's a regular seltzer bottle that you would see, like one of those tall, thin cans, and on the bottom it just says Kratom. Yeah. But it says in smaller letters, at first you see no sugar, no caffeine,
Right.
energy focus.
Right.
Yeah, it does list it as an ingredient.
Wow. So from here, I understand you have spoken with the Board of Health.
I have in Kingston. I've reached out to all the Board of Healths in the 12th Plymouth District, which is 6 towns. I happen to know Joyce very well. She did a project with my son when he was at Mass Maritime. She's a lovely, lovely person. And I went to the Board of Health meeting in Kingston, and they had, of course, there's 2 nurses on there. They've done their research and saw the dangers of this, because it's dangerous. And we have young people that don't understand the dangers of this.
Right.
I mean, they're becoming addicted. They're becoming addicted like they would to opioids.
Right.
And they are thinking that they're just having a health drink.
Health drink.
Yeah, it's really scary, especially being a mother of 4, right? And,
absolutely.
I have all 4 of my children are athletes and very health conscious, and I could see them easily doing this too. Or even friends. I had a friend that was over my house for a cookout over the summer, and she said, I was at, I think she said Cumberland Farms, and it was 3 o'clock in the afternoon. It's that time you need the coffee, and I saw this little thing for focus and energy, and I grabbed it, and she said, I went back to work and called my husband and said, come get me. I am a mess.
Wow.
Yeah.
Wow.
Yeah.
Well, this should enlighten a lot of people, me included. And it's scary when you find out about these things that are out there that come across to the public as very natural and healthy,
Right.
and are really harming us tremendously, and particularly our young people. So with all of that said, what are some takeaways that you would like people to have from our conversation?
Just, the big concern here is it's not regulated, right? So each product can have, you don't know how much is in each product. Some may be a really small amount where they won't have any effects, but some may be a larger amount. Or like this young man had 3 drinks, nausea, liver disease, addiction, it's a big thing. And, as we're very concerned, there's going to be a group out there that says it's helped them through addiction. Maybe it's gotten them off of something, and that's great as long as it's regulated.
Right,
and it's through a physician,
controlled.
right? It
Yeah.
needs to be controlled. Right now, we have something out on our streets that our kids can buy, that our older people can buy, that anybody can buy, right? Anybody can buy at a convenience store, at a gas station that's not regulated, and we don't know what those effects are going to be. And the young people's parents that I've heard from, or even young people that have taken it, even a woman my age, it is dangerous. It is dangerous, and it's addictive, and it needs to be regulated. And until it's regulated, I truly believe it should be banned.
Okay. Well, good for you for coming forth.
Thank you.
On all of our behalfs. It's very much appreciated. And, speaking for the community at large, thank you for all you do for us.
Thank you for saying that.
On a daily basis. I mean, always hearing about you and things you're doing for the town and the area, and it's very much appreciated. Positive things.
Great.
Thank you very much,
Thank you so much,
Representative
Janet.
LaNatra.
I
Take
appreciate
care.
it.
As always, it's my pleasure to host this program and to meet the wonderful and very interesting people I have throughout the community who are mindful of our public health and want to keep us all safe and healthy. Very much appreciate the efforts of Representative LaNatra and taking time from her busy schedule to come in and speak with us further about substance abuse awareness, particularly Kratom, new drug on the streets that is in drinks, energy drinks, and also the work that's going on in the community regarding mental illness. So with that said, take care. Think about the remarks that I made about vaccines and Tylenol at the beginning of the program. If you need to have a list of any of the vaccines, be it for an infant, child, adult, or older people, they are all listed on the Massachusetts Department of Public Health website. We'll have that on the screen. Take care, be happy, be healthy.